Cool. All right, so it's recording right now.
It sounds a little different, yeah.
So did you have any questions with the one thing with
The
the
part
lesson two? Uh-huh.
The only challenge I had is that I couldn't watch the video on Jonas Salk and his that whole video clip. It wouldn't come up. I have too slow of internet, so so I was trying to Google and figure out like all the answers to that part of that. So do you know what I'm talking about?
Was it the one where he was teaching us, like where he was just going through the PowerPoint?
I don't know. Is that what it looked like? I have no idea what it looked like. Was it a PowerPoint or was it like a video clip? I'm not sure, but it was the one about Jonas Salk where you're supposed to answer all the questions about him and as an example of doing statistical research or whatever, the very first six.
So what number was it on? Do you know?
I don't know, let me go back onto. So you watched Daniel, and he's like the first, like the oldest example of yeah, that was pretty cool. It's like, oh, I never thought of it that way.
That was pretty cool. So there was the one with Daniel, and then there was one. It was just like he took us through a PowerPoint, and I was kind of going through.
Oh, was it? Was that for Jonas Salk? Jonas Salk's first polio vaccine trial? Is that what that was?
He just talked about it a little bit, but not a ton.
It says 6 minutes, but it wouldn't bring it up for me. So,
Okay.
Find all the answers to those questions. What year did the Salk polio vaccine occur? All that stuff.
Was that on the homework assignment?
That was in that. Yeah, it was part of the homework assignment, and it's called Lesson 2, The Statistical Process and Design of Studies. And how I got there was the individual preparation, and step 2, where it says Statistical Process and Design of Studies. When you click on that link, it takes you to the online textbook, and that was part of the online textbook.
Oh, okay.
Have you seen that yet?
I didn't watch that video actually. So.
Oh, okay, then you're clueless like me too. I didn't. So I was trying to find out the information in other avenues because I couldn't. It wouldn't bring it up. So I'm hoping that we're on a waiting list to get better internet for another provider, but it's a long waiting list. So yeah, meanwhile, we live in a rural part of California. It's not very rural, but I mean, we are about 40 minutes away from an airport and the malls and shopping centers. But it's a nice where it's like not too close to this big city, but kind of you're on your own and have space, so you like it. Okay, so that was the only thing I had a question about was that so far. But I think we're supposed to do part 2 and determine what kind of method you would use for each scenario.
So did you have any questions on those ones, like for part 2?
I haven't even really looked at it until now because I thought we were supposed to do it together. So.
Okay.
Did you look at it at all?
Yeah, I did.
Okay, that's good.
Okay, so do you want to just go through it together then?
I would appreciate that very much, yes.
Okay. So we'll just start with number 6. It says, determine the correct sampling method for each scenario. A medical student researches the prevalence of aspirin usage by questioning all of the patients who enter her clinic for treatment. So which sampling method do you think that would be?
Is it convenience sampling?
Yep.
Or would you? Is it? Okay.
Yeah, it was actually. So if we have the online textbook, if you go, it's about 3/4 down. It's just 4.3. It's just all different sampling methods. I bet you saw that.
Yeah, I
Um,
was just getting that before we connected. Where was that?
um,
Yeah.
so yeah, so it just, if we look at the convenience sample, um, it just says involves selecting items that are relatively easy to obtain and does not use random selection to choose the example or to choose the sample. And so A would be convenience, just because it was everybody that walked in, and it wasn't random at all. It was just everyone that walked into um, into the clinic. So yeah, so is convenience. And then B, the Colorado Department of Health obtains an alphabetical list of 2 million adult Colorado residents and constructs a pool of survey subjects by selecting every 100th name on the list after randomly choosing one person from the first 1,000 on the list.
Let's see. Thing. Would that be systematic sampling?
Yep.
Because
Yep.
it's the kth whatever item in a population.
Uh-huh.
Okay.
Yeah. Yep. That's exactly right. So another example, that there was a video online that he did
Okay.
that made it really clear to me, was that he said, so at BYU Idaho, there are the devotionals every week, and he said if you were just to stand outside the doors for devotional, and while people were coming in, and for every sixth person that walked in, you would ask them your question, um, and then that would be another way to do it. So that way kind of made it really
All right,
clear.
I'll write that sample down. Okay. Every 6-person example. Okay.
Mm-hmm.
Okay. Okay. In a Gallup poll of 1,059 adults, interview subjects were selected by using a computer to randomly generate telephone numbers that were then called. So you have a population of 1,059. That's established. I think it's probably SRS, system random sampling, or cluster sample.
It's the simple random, just because it was kind of like everyone has the exact same chance of getting chosen.
Okay.
And so it's kind of like just pulling pulling names out of a hat.
Okay.
So yeah, so that's why it's that. And then D, a dietitian has partitioned people into age categories of under 18, 18 to 49, 50 to 69, and over 69. She is surveying a simple random sample of 200 members from each category. So we know, yeah, perfect.
That the clue there is the sample of 200. It's layered, stratified between. Yeah. All right, I'm getting this. All right. I haven't done any math homework. Is the homework like the actual doing calculations? Have you seen it yet? I haven't looked at it yet. The math homework.
No, I haven't. But I bet it's just like this. But I'm sure in the future lots of it will be math. But right now it's just kind of the basics. So.
Basics, not to scare us off too much here. Okay. So it looks like part 7 is the same thing. Okay.
Yeah.
So did you go through this already, all of it?
Yeah, I think it wasn't totally clear to me at first. Like, I read through it and I thought we were gonna we needed to do it together as a group. But then I read in a couple spots that we do this part by ourselves and then just ask questions if we need them
Okay.
during it. But since you didn't know that, we can go through the whole thing right now.
Okay.
And then
Maria could join us. I don't know what happened to her.
yeah, I know. I invited her again, but it didn't
Huh.
work. I'll try again.
I'm grateful at least we can have some conversation. Okay, let's see. Part E and 6. A Johns Hopkins University researcher surveys all cardiac patients in each of 30 randomly selected hospitals. Probably cluster sample, because it hasn't been one of the answers yet.
Yeah. Yeah. But yeah, it actually is cluster.
Yeah, that's one of the reasons why I chose that, but also because it's a large, well, it says Johns Hopkins research cardiac patients in each of 30 randomly selected hospitals. So that's a large group to sample from, a large population. So, and that's what makes cluster sampling work. It has to be a large group.
Yeah. Yeah, perfect. Good job. So then number 7, it says the American Medical Association wanted to determine general patient satisfaction with the patient's primary care physician. Determine the type of sampling method used in the following scenarios. A, they take a simple random sample of doctors and then sample all the patients that the doctor works with. So they just get a bunch of random doctors and then they take a sample of their patients.
Would that be simple random?
Well, it's a type of simple random sample. So to get the doctors, they simply just randomly pick those doctors, but then they get some of those randomly chosen doctors' patients.
Oh, okay. So determine the type of sampling method used in the following scenarios. Simple random sample of doctors and sample all the patients the doctors work with. Would that be cluster sample again?
Yeah, yeah.
Because they're all right. That one kind of threw me there. Okay.
Yeah, perfect. And then B says they put all the residents' names in a computer and use a random generator to get a sample of 100 patients.
That would be systematic. Oh no, maybe not. Residents' names in computer. Use a random number generator to get a sample of 100 patients. Residents' names.
So because they're putting it in a computer and everybody has the same chance of getting.
Okay. If you say that, that tells me it's simple random sampling.
Yeah, good job.
Because it's not in the answer like the first one was.
Yeah.
Okay.
And then this one kind of threw me off, but I think I understand it now. So C is they divide the residents up by gender. So we have, I'm guessing the 100 patients. So we divide them up into gender and then do a simple random sample of residents within each gender.
Okay. Well, for me, that would be a homogeneous group because you're doing with one gender. So I'm doing stratified sampling.
Yeah, yeah. Yeah, and I watched the video on this one, and he said the real key word, like you said, was within each gender. And so, like you said, is a homogeneous. So it's
homogeneous.
that
word.
Yeah.
Homogeneous, caramel, however.
Yeah. So good job. And then D is they randomly pick key intersections in the city and then picking every 5th person that walks by after randomly picking one of the first 5 people to be in the sample.
Convenience sample, which is not recommended. That's what it said. Should be avoided, right?
No. So if they're do you remember the example from like if they're walking into the devotional and they pick every sixth person?
Yes, you told me that every 6 persons, a systematic sample.
Yeah, good job.
All right.
Because in this one it says they pick one out of every 5 people.
Yes, that should have been the clue. Okay, thank you for that.
Good job.
Okay. Determine for each scenario whether it is an observational study or an experimental design. It was an experimental design to determine the response, treatment, and subjects. Oh, yeah. Okay. You already went through all this?
Uh-huh. Yeah.
The Center for Disease Control obtains current flu data by randomly polling 300 men and 300 women. Okay.
So is that a an experimental design or is it an observational study?
Probably observational
Yeah. Why would it be observational?
because they're just polling, which means they're just asking questions, and that's part of observing is just asking questions. You're not manipulating the situation or anything to see what the response is.
Yeah.
So that's
Yeah, perfect. Yep. So that's all you need to put for that one is observational study. So and now this is the fun one.
You plan to conduct an experiment to test the effectiveness of Sleepy's, a new drug that is supposed to reduce insomnia. So you randomly divide 1,000 patients into 2 groups, or another a placebo. You record the gender of each subject. You will then observe how many hours of sleep they get in a week. Okay. For sure, that's experimental design. You're manipulating.
Yep. Yeah. And so then now we need to find the response, the treatment, and the subjects.
Okay. So response.
So what like when we're thinking of we're trying to find or what are we looking for?
Effectiveness of Sleepy's. Right?
Uh-huh.
Or what did you put?
Well, it's like the effectiveness of sleepies or like the number of hours that people or hours of sleep for people who took sleepies.
Okay, so number of hours. That's more specific. Okay. Number of
Yeah.
hours. Who slept, right? Okay.
Number of hours of sleep for the people who took sleepies.
Okay. So let's see, what's next? The treatment.
Mm-hmm.
The treatment is just taking sleepies, right?
Uh-huh. So sleepies is one, and the other one would be the placebo because that is a type of treatment. Like they're just saying, um, when they say treatment, they're thinking of all the parts, what people would take. So either sleepies or placebo are what people are taking. So
Right. Okay. Okay, and then so what was the next part? Subjects. The subjects is the one group that has the placebo and the one group that has the sleepies, right?
yeah, you could do that, or you could just say like the 1,000 insomnia patients
Oh, okay.
subjects. But if you broke it down more, it would be the people with the placebo and people with sleepies. So.
Okay. Let's see.
And then,
September 2004. I'm sorry, go ahead.
huh?
I'm sorry, what were you going to say?
I think that was the last part for that one was just the subject. So.
Okay. Yeah,
But,
that's what I see.
cool.
In September 2004, Newcrest Pharmaceuticals Inc. announced the results of its first human trial. a topical form of its skin ointment. A total of 224 patients diagnosed with skin irritations were randomly divided into 3 groups as part of a double-blind, placebo-controlled study to test the effectiveness of the new topical cream. The first group received 0.5% cream, the second 1% cream, and the third group received a placebo. Groups were treated twice daily for a 6-week period, and the degree of skin irritation was recorded at that time. Is this a design experiment or observational study? Do you hear my little one crying? He doesn't want to go to sleep on his own. Okay, so I would say it's a design experiment.
Yeah, perfect.
Yeah.
Yeah.
Okay. What are the subjects? 224 patients with skin irritations?
Yeah.
Okay. Okay. What is the response variable in the experiment? Let's see. Response variable. What does that word mean? That's the one word the definition I didn't find. So I don't know what that means. What does response variable mean?
The response variable is very similar. Well, it is like in number 8, where we looked for the response. It's that. So we just look for. So in number 8, we found that the response was the number or hours of sleep for people who took sleepies. So like the thing that responds to taking sleepies. And so C for number 9 would be, or like the response variable would be the degree of skin irritations observed in the patients. And that's because when they put the cream on after the 6-week period, they look back and they say, what's the response to putting on that cream?
Mm-hmm.
And it would be the degree of that irritation for them. So
After the treatment?
after the treatment, yeah.
Gosh, it sounds like some of these things just seem familiar or part of life because my son has eczema really bad, and so it's like an ointment that I put on him. So, yeah. So this is what they do. Okay. What are the treatments?
So what are the things that they give people during the experiment to see what happens?
Well, it's a percentage of cream. So one group gets 0.5%, one gets 1%, and the other one gets nothing. It's just an observed group, the placebo group.
Yeah, perfect. Yeah, those 3 things. The 0.5%, the 1%, and the placebo. Perfect.
Okay. All right. I think, is that it? I think that's it.
Yeah. Yeah.
Take a look at the rest of what we have to do this week. How many units are you carrying? How many classes?
I'm just doing 7 credits. So this one and medical terminology and the developing world.
The developing world. I wonder if I have to take those ones. I haven't looked at my list.
Yeah.
So, what is your career plan? What are you planning to do?
I want to go to dental school.
Oh, okay, awesome.
Yeah. I got a lot more school to do, so.
Me too. I know. I started, and when I was right out of high school, and then I got married. How was I? I was 21 when I got married. And then I helped my husband get through school, and I put school to the side when we started a family. And I was actually expecting my third when I started Pathways. I don't know if you heard of Pathways.
Yeah.
And I completed that program so I can get into BYU, Idaho. and I was just knew I was expecting, and I was just kept on having this feeling that I should go back to school, and I'm like, I was denying the promptings. I'm like, I don't see why I should go back now. It's not seem very plausible in our busy life, but I couldn't deny the promptings anymore. So okay, I'm gonna do it. So I did the Pathways program, and then now I'm officially. This is like my first official BYUI class. So yep, yeah, that's my story. But it's tough. But I only could take one class right now until it gets easier as far as family life goes. So.
Yeah.
My long-term goal is to be a speech therapist. So, and you have to have a bachelor's, master's, and then you have to have clinical hours, which is probably the same thing for dentistry too. I'm assuming. So.
Mm-hmm. Oh, that's awesome.
Yeah. Thank you. So, all right, it's great to have this first meeting. Very successful. I wish our other two students could be in with it. Hopefully they can. So, anyhow, have a great day. I'll see you at 8:30 on Thursday.
Yeah. So I think we're supposed to do the quiz together, and I think it'll be really fast.
Oh, okay. Let me go to that then. Okay, if you let's see. And you can hear my son crying in the background, but he's on a sleep protest and then doesn't want to sleep. Okay. Where do we find that quiz?
If you go to whoopsie, that's lesson 3. I don't want to do that one. Okay. So go to lesson 2, and then group meeting.
Hold on.
You can go get him if you need to.
You want me to go get him? Okay.
That's okay. I feel bad.
Oh, come here, buddy. Hold on. There's Walker. You Walker.
Hey.
Says I don't want to.
How old is he?
He's 10 months.
Oh, good. But yeah, so.
Smelly, that's why, huh? That's why you can't. We'll get to that later. All right, let's see. So is it group meeting?
Yeah. So you just go to the group meeting, and then you'll see the part, step 3 just says, after your group has clarified their understanding for part 2, click start below to take the group meeting quiz. While you are required to work together on the quiz, each member of the group must submit his or her own answers in order to receive credit. So I don't think it'll take very that. Holy man.
So we have to do it together?
Yeah, I guess so. So are you there?
Yeah, I'm here.
Okay, cool. So number 1 says, I completed the individual preparation assignment before attending. Yes. I actively participated in this week's group meeting. True.
Okay. So, true.
And then number 3 says, researchers would like to determine if reviewing material consistently within an hour after class helps students perform better on exams than if students wait to review material the day before the exam.
True.
To answer this question, the researchers are trying to determine if an observational study or an experiment would be more appropriate. They are discussing who the population would be and how they will determine which sampling method will best represent the population. Which of the 5 steps of the statistical process are the researchers currently applying? They're designing the study, wouldn't you say?
Yeah.
Cool. And then number 4, a researcher has collected the results of a survey where the participants were asked how many hours of TV they watched each day. The researcher tallies the frequencies for each category and computes mean numbers of hours watched. She then creates a histogram to help illustrate the overall distribution. Which of the 5 steps of the statistical process did the researcher apply? The describe data.
Hold on. Okay, yeah, the histogram. So when you describe data, that's when you usually do the graphs, that's some way to just, okay, got it.
Perfect.
Mumbai, India is quickly a growing city of importance in its own country as well as the global economy. A marketing research firm has been asked by a prominent fast food restaurant to help determine if the citizens of Mumbai would support this fast food business. From a list of all registered taxpayers, 3,000 names are randomly selected. Each individual on the list is mailed a brief questionnaire. The researchers received 1,049 responses. The population is 3,000 people who mail a questionnaire, the 1,049 people who respond. The citizens of Mumbai cannot be determined.
Wouldn't it be the 1,049 people who respond?
It's the population actually that they got responses from, so I agree with you.
Okay. 'Cause, yeah, I think.
Oh, wow, there are a lot of questions. There's 17 of them. Holy cow. Okay, we'll get through it. Let's see.
And this is Mumbai, India.
Go ahead.
Is a quickly growing city. Oh, isn't that the same one?
Oh, sorry.
Oh,
Yeah,
oh, it says, a marketing research firm has been asked by a prominent fast food restaurant to determine the enrichment of fast food. From a list of all registered taxpayers, 3,000 names are randomly selected each. Yeah. Okay. The researchers received 1,049 responses. The sample is
3,000 people.
I'm trying to think. Would the number 5, would that be the 3,000 people, and then would the sample be 1,049?
Yeah, I think we got it wrong. I think it's the what's the first one? Does it say? Oh, yeah. The population is the group which you draw your samples from, right? So that's the group that they started out with the responses. So yeah, I think we need to switch the answers. So 5 is 3,000 and 6 is 1,049.
Cool. Perfect. Okay, yeah. And number 7, studies have shown that retention of classroom materials can drop as low as 58% within 15 minutes of class and within 44% after the first hour after class. Wow. This forgetting curve continues so that within 6 days only 25% is remembered. How can a student conquer this forgetting curve? Researchers in this study claim that constant review is important. Suppose your teacher wanted to test this and invited you to participate in a study where you were asked to review specific material 15 minutes after class for 10 minutes. 15 minutes after class for 10 minutes. An hour after class for 10 minutes, and then again 2 days after class for 10 minutes. Your teacher then gives you a short 10-question quiz where you score out of 10, where your score out of 10 is recorded. What type of data is your teacher collecting?
I think it's quantitative.
Okay.
You think it's categorical?
Yeah, you're right. I
Description
think it's
of
quantitative.
things.
Yeah, I think you're right.
Specific time variable there.
Mm-hmm.
Okay.
And then I think it's just the exact same scenario, but then it says he then records your response. It says after the 6th day, your teacher asks you if you feel confident that you have retained at least 50% of the material. He then records your response as yes, no, not sure. What type of data is your teacher collecting? Categorical. Cool.
Okay, number 9. Studies have shown that retention of classroom materials can drop as low as 50% within 15 minutes of class and within 44% after the first hour after class. Okay, same thing. This forgetting curve continues to so within 6 days, only 20% is remembered. How can a student conquer this forgetting curve? The researchers in the study claim that constant review is important. Suppose your teacher wanted to test this and invited you to participate in a study where you were asked to review specific material 15 minutes after class for 10 minutes, an hour after class for 10 minutes, and then again 2 days in class for 10 minutes. Your teachers also looks to the group to give no review to the material over the 6 days. This group is called the control group.
Yeah, that's what I was going for too.
It doesn't get any treatment.
Yeah. Cool. And which of the following would be considered an experimental design? Experimental design, okay. A telephone poll asking people about whether or not they vaccinate their children, no. Administering the tuberculosis vaccination to one group and giving placebo to another, yes. Yeah.
So it's B. It's the second one.
Yeah. Cool. This is going by pretty fast. And then in a study to determine the average wage of working people in Mumbai, which of the following would be the best example? Average wage. Every 10th worker that you meet as you travel the streets. All the workers in one working district. No. Many randomly selected workers in several working districts. I think it'd be C. Wouldn't you think?
Workers in each of several working districts in Mumbai.
Yeah.
I think so, because you have a larger population to draw from. So therefore, you have a wider range of getting the data that you need. Yeah. If you chose a worker off the streets, you're not sure their background, if they really are working, or I don't know. That doesn't seem like it would be a very accurate research.
Okay.
So
Perfect.
third one, any randomly selected workers.
Yeah, perfect. Number 12. You want to become the next Jonas Salk and produce a vaccine that will help cure children of respiratory syncytial virus, RSV. You test the vaccine and compare it to a placebo and randomly choose one group of children to take the vaccine and one group to take a placebo. What or who are the experimental units or subject? Wouldn't the subjects be the children?
Yeah, I think so. You test it. Okay, let's do that again. What, or who are the experimental units or subject?
Yeah, I think it'd just be the children, right?
That's tricky. Ooh.
Because we go back, because I just went to the homework where it's, oh, I hope we're allowed to. Didn't say we're not allowed to.
I don't know if you're allowed to go look at the homework. I didn't say you can't, but I don't know if you're allowed to look at notes.
Yeah, thinking back at that,
So.
Yeah. So I think it'd be the children, just because the parents, that one's out. I mean, it didn't have anything about the parents in there. So.
Parents, not administration. Either the children or the vaccine and placebo. But what do you call the vaccine and placebo?
That would be the
treatment, right?
The what?
The treatment.
Yeah, treatment. Yeah.
So define what the children are. They are the units, experimental units or subject. Okay, I feel better. I'm going to do the children.
Okay, perfect. And then number 13, you want to be, okay. And then it's the same thing, but what are the treatments? Just what you said, the vaccine or placebo. Cool.
Okay. Sweet.
In 1992, the U.S. government supported a study that was run for 15 years, where 4,608 low-income families were given a chance to move to less impoverished areas. They distributed vouchers and provided various support systems. The researchers wanted to determine if getting people out of poor neighborhoods would reduce the poverty level of U.S. citizens. The low-income families were randomly assigned to one of the following three groups. Number one, the MTO Low Poverty Voucher (LPV) group, which received Section 8 certificates or vouchers usable only in low poverty areas with less than 10% of population below the poverty line in 1990, along with counseling and assistance in finding a private unit to lease. To the traditional voucher group, which received regular Section 8 certificates or vouchers, geographically unrestricted, and ordinary briefings and assistance from the local public housing authorities. Number three, the control group, which received no certificates or vouchers but remained eligible for public or project-based housing and other social programs to which families would otherwise have been entitled. This study is an, would that be, I don't know, because they're not just observing, I mean, they're taking people into
Right.
different.
Manipulating anything in the two groups, or I mean, that's what experiment is, right? Is they're manipulating something and then see what the effect is. Observational, they just watch. I mean, they're just observing. They're not doing anything to have a response based on manipulation. So
would it be experiment then?
I don't know. Let's see.
Just because.
Yeah, it would be experiment because in each of the groups, something was done to help that group. It wasn't just they were observed. In the first group it says they were given counseling and assistance in finding a private unit to lease. So there was something to manipulate or to create a response. It's just not an observed group left alone.
Okay.
And yeah, so I think it would be experiment.
Yeah, I think so too. In the number 15, it says if a p-value of 0.0002 was found for the study described above, then we could say that there is about a 0.002 probability of obtaining the actual observed result, or one more extreme, assuming the null is true.
Should we have done some math right now? Okay.
What?
P-value 0.
So the null, in the reading, it said the null is kind of just the common belief or common truth, kind of that what's the word I'm looking for? Hypothesis.
Yes.
The null is just kind of what everyone thinks is true, and then the p-value is the probability that was found. So a p-value of 0.002 is found for the study described above. And we could say that there is about 0.0002 probability of obtaining the actual observed result, or one more extreme, assuming the null is true. Yeah, I think that's true.
So can you replace the word null as meaning the hypothesis?
Yeah, so the null is a type of hypothesis.
Okay.
And then I forget what the other one was called, but so the null is kind of just the common truth, or kind of what we all think of when we think of a situation. But then the other one, I forget what it's called, but it pretty much, when the null or the common truth is denied, or they find evidence that says that it's not true, then it is the other one. I forget what it's called though.
I can't think of what it is called either. I need to go over my notes. I'm in that study group, where it says how much you retain after class. Okay. So true for 15.
I think so, yeah. And since the p-value is low in question 15, the researchers could conclude that the results are significant in providing low-income families with an opportunity to move away from low-income neighbors does not or does make a difference in poverty levels. What? No. False. I think that'd be false. Just because the p-value is low, and so the probability of those people being moved to or being moved away from low-income neighbors, it didn't help them what they were looking for. So I think that would be false.
Okay. I still don't quite understand that one. Let's see. How can I explain that better? Okay. Research can include that the results are significant in providing low-income families an opportunity to move away from low-income does make a difference in poverty levels. Okay, so because of 15, that value is low, you're saying? The probability is low, so therefore it's false. Okay. All right. Last one. See how we know. Remember the acronym. D.
It was
C. D. M. Is that what it was?
I think it was David something. I think so. It was design the study was number one. So it'd be
Step one. Design the study. Daniel.
Oh, Daniel can discern truth or discern more truth.
That's right. Design. Yeah. Okay. So step one is design the study.
Daniel can. So step two is E. Daniel can. So collect data. So number one is E. So Daniel can discern. Step three, discern. 4 is B.
4. Okay, you're
more.
D, C, and then D is discern. Yeah, step 3 is discern. So that would be describe the data, you said?
Yeah, so it would be
D.
Describe the data. And then 4 is A.
Make inferences. Let's step 4, A, and then...
Which is like 5 is A, if that makes sense. And then step 5 is D. So number 1 is E, 2 is D, 3 is C, 4 is
B.
Huh?
Did you say D or B for 2?
I have D as in dog.
Oh, I have B. Take action. Step 5, truth. That's wrong. You're saying D. Take action is describe. Right. You're saying D. D is discern.
So the first step is design the study, which would be C, and then the second one is collecting data, which is E, and then after we collect the data, we describe the data, so that's 3, so that's B. And then after that, we go to we describe the data, and then make inferences, which is A, and then after that we take action, which is D. Does that make sense?
It does, but I just want to make sure that that's right. Okay.
Like the right letters and stuff.
Yeah. So step 1 is Daniel, and you said collect data, okay? I don't know. one. Design a study. That's step one. Design a study. And you said B?
For which one?
I'm so confused. I don't know why I'm getting all messed up here. Okay, so it's the acronym is Daniel can discern more truth. Okay, so the first step. All right, you're fine. All right, so the first one is design the study, and that's wouldn't that be step one? So design the study, which is number 3. Wouldn't that be C?
Yes.
Okay, I have it wrong then. All right, and then the next one is can discern truth, or can, let's see.
Can, so it'd be collecting data.
Collecting data. So that would be E, you said. Okay, I got that. And then D would be discern. Step 3, discern. So that would be D, describe the data.
Number 4, so describe the data would be B as in boy. Okay. Because it's the third step.
Okay.
So it's Daniel can describe, or can discern. Discern, so yeah, B. And then more would be 5.
So that would be E. No, that's wrong. More would be A. Okay, so
A.
number 5 is A.
Yeah.
Okay.
Truth is.
I have 2 that are the same. I've got to fix that. Okay, I have number 2, take action as C.
That would be D.
That's wrong. That one is. Let me just go over them again. I'm sorry. Okay, number 1, collect data. That's E.
Yes.
That's, okay. Number 2, take action. That is C, but that's wrong. That one is
D.
step 4. Or B. It's B. Step
It'd
5.
So number 2 would be step 5.
Right.
So that would be B.
I'm starting to get it. Okay, so I have E, B, and then C, and then it would be D, A. Is that right?
Just switch the D and the B.
Okay. D and the B. All right. So E, D, C, B, A.
Uh-huh.
Okay. All right. I wonder if you get automatic grading or you have to wait. Let's see. We're ready to submit? Did we answer all of them?
Yep.
Have you ever done that before, where you don't answer one of them and you get it you get it wrong because you skipped one? Have you ever done that?
Yeah, but it usually tells you that you haven't answered one. So.
Oh, really? It hasn't done that for me. He always dings me for it if I miss it. So, sorry, can't see me there. Okay.
Submit.
All right. Submit. Here we go. Am I ready? I guess so. We got a B.
Yeah, I got 89%.
How did you get 89? I get 84.
Oh, really?
Yeah, I must have answered something not right, as you did. Dang it. Okay.
So I missed number 5. I guess the population is the citizens of Mumbai. Okay, that's fine. And then number 16, I guess, was true.
Number 16? Yeah.
Okay. What other ones did you miss?
I must have still filled out number 17 wrong. I did. And I have EDCBA, and that's not right?
That's what I have.
And you got it right?
Uh-huh.
What did I do
Oh,
wrong?
that's weird. I wonder if, I don't know. That's weird.
Do we have not the exact same quiz? But we do, don't we? Because we have to do it as a group.
Yeah, that's what I thought. So,
What did I do wrong? Okay, so number 1 was E, number 2 was D, number 3 was C, number 4 was B, and number 5 was A.
uh-huh.
Hmm.
And then maybe look over to like the A, B, C, D, and E. So my A was step 4.
Oh, that's what happened. So I was relying on what you were reading, but it's
Oh,
said it differently. It's my A is step 4, my B is step 5, C is step 1, D is step 3, and E is step 2.
oh yeah. Yeah, ours were different. I'm sorry.
That's okay. We're learning. We'll know next time. We'll be savvy the next time.
Okay.
So at least we got a B. It's passing. It's good. Okay. All right. But we're learning. All right. So I feel we got something done. That's awesome. I can click done on there. All right.
Well, perfect.
Um,
Alrighty.
my only concern is that how long did that take us? I mean, we've been on the phone how long? Let's see. What time is it? It's 9:56, and we started 8:45 roughly. So
And I don't think it'll take us that long normally, um, just because this time we went through the whole, like that whole part 2.
yes.
Um, but normally we'll just come on and just ask questions if we have any.
Okay. So we need to be prepared, even though it says to do the part 2 together, that ultimately we should just help each other. We have a few questions on that, and then our time together really should be doing the quiz, is what it sounds like.
Yeah, yeah, that's kind of
Is
how
that
I
right?
understand it. So,
Okay, me too. And now I'm getting an understanding of it. So just so it doesn't impact your work schedule, getting to work on time and everything. So
okay.
um, I don't have my kindergarten I don't have to pick up until 11:25. So yeah, so I'm good 8:45 on Thursday. But once you start working, we just have to make sure you have only really an hour. You can still make it on time.
Yeah, and we'll play it by ear. Like we'll figure it out. So.
Okay, I like your easygoing spirit. That's awesome. Very good. All right.
Alrighty, well have a great day. Thank you so much.
Thank you so much. Take care.
All right.
Bye-bye.
Bye-bye.
Everyone, see you. Okay, bye.
Bye.